for experienced physicians and award-winning physicians, I might add, that could tell things what it's like to be a patient and a physician. You know, I find myself as some people love me, some people hate me, and I'm just trying to figure out a way to deliver health care to the best of our abilities. And so we're going to explore how you look at it from a physician, how you look at it from a patient, and how we can be healthier. So I'm really excited about this presentation, and I thank Emily for coordinating all this. So let's actually go on to the next slide over here. So exciting times. So one of the things is that we're really working hard at evolving our concept to education, getting better all the time. So Stuart, tell us about this this webinar series that we're doing and how to get better at it.
Perfect. So I'm going to jump in a few seconds to some of the changes we made to our YouTube page so that it's easy to navigate for all of our patients. But for those who are joining us currently on the webinar, just a few housekeeping things. If you notice at the bottom of your screen, you'll see a mic. It might say mute, it might say unmute right now. That is where you monitor if your mic is on or off. So if you see it glowing red, that indicates that you are muted. If you want to unmute yourself and ask any questions, you can always click the button, and we're happy to answer the questions that you have. We encourage you to open up and turn on your cameras if you're comfortable. Doesn't matter if you're eating, if you're with other people right now. We are encouraging everyone, as you can see Dr. Kearney is having a meal right now. We're encouraging everyone to turn on their cameras so we can see their faces if they're comfortable as well. And of course, there's also the chat function in the bottom right corner. That is where you can ask any questions, and throughout the presentation, we will answer all of your questions when the time comes. Emma, if you want to go to the next slide. So for those who are joining us on YouTube, it's very similar as well. We can't hear you, but you can still engage in our presentation. There's a chat function on the right side of the screen. There you can propose any of the questions, and I'll be monitoring it throughout the presentation. And we will make sure that we address those questions before the end of the presentation today. Now, and on the next slide, you'll see that this is what our new YouTube page looks like. So as you can see in this moving video right here, this is the home page. So as soon as you go onto Dr. Kearney's YouTube page, you'll see all of the different playlists that we currently have going. As you can see, we have pre-recorded web series, we have live web series, and we also have new playlists that we're constantly making and adding all the time. So we've basically made a few changes just to make it as easy for you as possible. We're also going to be making a video in the near future to explain how to navigate our YouTube page so that you understand all the cool tips and tricks for how to navigate our YouTube page.
Hey Stuart, what's a playlist?
So a playlist is a compilation of all of the videos from a similar theme. So as you can see right now, we're scrolling down into something called What's on Dr. Kearney's Mind. So here is a little web series that we're doing where Dr. Kearney gives us his little message of the week. What does he want to share? So in recent weeks, it's been how to come prepared for your appointments. And that comes with keeping a journal, logging all of your medications, your blood pressure, your questions you have for Dr. Kearney, so that you can have conversations and ask all the questions that you need to, and make sure that you don't forget them when you see Dr. Kearney or call him on the phone. You can also see we have live or pre-recorded web series, things like Cooking Club, Sugar Club. We have a playlist on how to manage your health, and there you can find all of our videos that fall into that theme in one place. So it's really easy for you to navigate as soon as you click on the different playlists that we offer.
You know, what's kind of interesting is that I remember when when I went to class and to school, and we're going to go back and talk about that. But now school's evolved where we have online, in person. I kind of like some of the aspects of virtual learning right now because I found out is that I forget most things, and so Stuart, I don't know about you, is that it said that we're all forgetful, we learn things, and so I like the idea to go fast forward, back and forth, and look at these sorts of things. So I found that to be a very, very good feature. Also, too, is that if I miss something, I can go back and look at that later. So I'm actually appreciative of that.
Mm-hmm.
But what I also like is live discussion. So that's why we encourage you to have dinner. I'm having a little vegetarian plate here tonight. One of our patients, they got me this sparkling water, kind of nice, so I'm trying that out today. It's just basically, a few little herbs and some carbonated water. It's kind of nice. No artificial sweeteners, no sugar. So I'm trying something new. And one of our patients here brought in some soup tonight. So that was kind of nice too as well. So what I'm learning is how to work together. And you can see on the right, you can see some of the recent videos. One is called prescription renewals and medications in general. And Maria has been worked really hard on that. And what I learned is in 16% electronic medical records, how we record information right now, the medications are right in many countries. So there's lots of room for opportunity. Everybody says, well, the gym's closed. Well, how to stay active indoors? There's something, some ideas. And I'll show at the end is how I'm going to stay active outdoors during the winter time. In the bottom is that about 5 of our team are going to develop an app for the clinic and for your health. And 2 priorities to me is that getting medications right and making sure that you arrive if you have a test and that you make sure you come to that are important features. There's lots of great apps on meditation. There's a lot of good things on relaxation and blood pressure. But what I'm finding right now is that we're all a little bit forgetful, and getting our medications right are really important, because the 3rd leading cause of deaths right now is medical errors. So, heart disease and cancer is still the number 1 and number 2 cause of death, but the 3rd cause of deaths is medical errors. So you have to sort of think about, are you an error waiting to be happening, or how are you going to prevent that? So, and it's just nice. So turn on your cameras. Let me have a little look at yourself. All I care is that people are learning and enjoying themselves, and have dinner and go back and look at this. So what's the next slide?
So Emma, on the next slide, you'll see something that we're integrating on all of our new videos as well. Dr. Kearney said that, people forget sometimes, and you want to go back and look at something that you've watched already. So what you can do is we're now introducing something called chapters or timestamps on all of our videos, so that all the major sections of every video, including this one, is going to have a timestamp of all the major topics we're covering. So in our last video, we discussed things such as open communication and medication errors. We talked about prescription renewals and how we're doing it at the clinic. And we also talked about using a journal for your appointments. All you would have to do is you would have to click on the timestamp either at the bottom taskbar or in the descriptions of the videos, and you'll go right to that point so that you'll be able to get that information right away. So it's a really cool way that YouTube has built in how to find information that you might have forgotten in a long video. So we're going to be introducing that, so you can always jump to any point that you want in our presentations and learn about that information.
Nice.
And on the next slide, Emma's going to be introducing the things that we'll be discussing today in our presentation.
Everyone. Hi everyone, can you hear me? Perfect. So my name is Emma, and today we are very lucky to be joined by both Dr. McGarry and Dr. Hill. So for today's presentation, we're just going to start off with a brief introduction, and then we're going to go on to the pre-diagnosis of Dr. McGarry's life, and then what happened after when he was diagnosed, and then we're going to finish it off with some main takeaways. So going to the next slide. My name is Emma. I'm a 3rd-year student studying at McMaster right now, and I just wanted to say thank you for everyone for taking the time out of your night to join us. So we feel as though the patient and the physician perspective is an important conversation to have, because for myself personally, it brings an interesting perspective that I don't think about often when I go to the doctors, and it just offers that unique perspective. So we did previously do a little bit about the physician versus patient perspective with Dr. John Deacon, and he's a neonatologist, and you can find a little bit more about his life in the atherosclerosis video. So moving on to the introductions. So as you can see over here, to the left is Dr. Joanna Hill, and to the right is Dr. Philip McGarry. So Dr. McGarry and Dr. Hill are both physicians trained at the Medical School of Western Ontario, where they actually first met. Since then, they have married, they have moved to Toronto, then moved to the region of Niagara Falls, where they opened up a family practice in July of 1979. So fast forward a few years, they are now semi-retired, practicing a few days a week in long-term care homes for complex care patients. And right now, they're really focused on taking care of their health and just enjoying life. I'm super excited for today's presentation. And without further ado, I'm going to hand it off to Dr. McGarry to talk a little bit about his life, why he chose medicine, where he went to school, what it was like opening up a family practice with Dr. Hill, and so on.
Okay, well, thank you for the introduction. And medicine runs in my blood, I suppose, because I'm the fourth generation doctor in Niagara. And I remember as a youngster and learning how to drive, my dad would take me on house calls to learn how to drive, and he'd take me into homes, and before long I was taking blood on patients, giving B12 shots, taking the blood pressure, and while he's writing up the charts, I would be taking care of the patients. So I had lots of exposure, and I enjoyed it, and I felt it fit my personality, and I wanted to make a difference in this world and improve people's lives. So I fit right in, and I was lucky to get into Western's medical school, and then meet my wife for the last 44 years, and we enjoyed working together. I remember opening up our clinic. The first thing I did, I got a call just because I got my license, saying, "Oh, Philip, I heard you're coming to town. Can you do my emerg shift tonight?" And I think it's the very first thing I did, wasn't it, trying to work in a emerg? And here I am with all these very ill patients, right out of residency, but it went well. I saved a few lives over the first few weeks, and you quickly build up your reputation, and then we started our practice. A lot of my dad's friends are older physicians. He was passed away by then, unfortunately, but they were a great help, Joanna?
They were great mentors.
And being great mentors, and I enjoyed mentoring because I remember how well we were mentored with the physicians in town. And we had several offices. Eventually, we ended up in a family health team with 6 other doctors and a nurse practitioner. I think there were 9 of us on Queen Street. You'll see the building there. And we practiced there for the last 12 years. And then in 2011, we thought we'd just slow down. I had some brothers, 2 brothers, unfortunately, died the same year. And I thought it was time we slowed down. I enjoyed doing geriatrics and long-term care. Joanna was good at it as well, so we left the practice and just do long-term care. It has its up and downs. Right now I'm doing a COVID outbreak at one of my homes, so there's been a bit more stress this week, but as a rule, we work for 2 or 3 days a week, and we've joined a golf club, and we exercise, and that, yeah. I was lucky to get the Physician of the Year award in 2014, and it's for long-term care, Ontario Ontario long-term care clinicians, and I was awarded that in 2014 for my work in long-term care. So I was honored to receive that honor, and I'm just retiring from that committee work. I've been a board member of Ontario Long-Term Care Physicians as well.
So first of all, I want to thank you for your years of service, and this award is a big award. And he's not just a smart guy; he's a nice guy. He's also smart enough to marry a very smart lady too, as well. And I just love the way our discussions, in many ways. Just go backtrack a couple slides. I just want to go back one more back over here. So, Joanne, what was it like to graduate as a woman in medicine at that time back then?
Well, it was a wonderful honor to be a medical student at Western. There were 105 students in our class, and there were about 30 women. So there were women, but we certainly were not in the majority. So So I know over the last few years there have been so many more women in a lot of the professional schools. Back in the day when I went to medical school, there would often be sexist jokes, that they put up on slides and one thing and another. But to tell the truth, our class was very supportive of each other, and we were a very cohesive group. So going through medical school was a wonderful experience for me. And actually, of our class of 105 students, there were 7 couples that got married to each other. So it was a really wonderful time in our lives.
Yeah, I remember medical school myself. I went to McGill, and we were a class of 150, and I still love our class reunions. There's a real bonding in medical school. You come in with ideas, and people train, and you change together. So you said something very important, is that most people come in to serve. Your doctors want you to be healthier. They're on your side. And you better not forget that, because they're one of your best allies, and they work extremely hard, and it's a real privilege to serve. So I'll be quiet for a little bit. Let's go into more of the story.
So how I was diagnosed, Joanne and I love sports. We like to ski every week in the winter, and a few winters ago, it was heavier snow, and on that particular day, you had to do, if you're a skier, you had to do a lot of jump turns to go through the moguls, and I'd done it many times, and I was getting this heartburn at the bottom of the hill, and when I would stop and go on the chairlift, it would go away, and then as we went down the hill again, it would start up again. And I kept telling Joanna, what did we have for breakfast or lunch? And Joanna said, you know what, Philip, we're going to stop skiing now, and I'm going to phone the family doctor Monday morning. And so I saw my family doctor. I got referred to the local hospital in Niagara, and before long I had an angiogram and found to have coronary artery disease. Luckily, I think because we are so active, I got the symptoms of atherosclerotic heart disease, lack of blood going into the artery before I had a heart attack, and I've been treated. I also developed spells of irregular heart rates, and that would take me to the hospital from time to time, but through Dr. Kernew's help and medication, I haven't had an attack like that for over a year now. So that's been wonderful. I didn't really have many risk factors except family history. I didn't smoke. My blood pressure was controlled. I did have a lot of stress in my job. Being a family doctor, you're there to serve, and it isn't an easy job. If most people, it's not a job, it's a career, it's a lifestyle. It's a calling, yeah, it's a calling. And but apart from that, the normal risk factors like smoking, high cholesterol, that was acceptable back then anyway, we're all okay. The only risk factor I had is my dad had heart disease in his 50s, and I had a grandmother who was deceased before I was born. I know my dad took care of her in her 60s with heart disease. And as I learned later, her father had heart disease and was diabetic and overweight, and that was probably before, in the 19th century. And I think that's where I picked up this cardiac atherosclerosis gene. Luckily, we exercised and we had the lifestyle that alerted me that there was trouble before I had a thrombosis and possibly and possibly would die. So that's how I was diagnosed. And I met Dr. Kernew I had read some studies. I think being a physician, I'd read some studies. There was a new treatment had come out where there was a antibody treatment where they had good success at lowering cholesterols, and I wanted to find someone that would be more aggressive with me, because I knew I'd need to do something. You can't change your family genes, and but maybe there's a way I can overcome this. And I really want to. I have 3 children who are married. I have 6 grandchildren. I love them dearly, and I want to live for long enough to see them prosper and grow up. And our children and our grandchildren give us great joy. I love my wife, and I want to enjoy a happy retirement years and be healthy. And I knew there's got to be a way to overcome this, and to at least this chronic disease can be managed. And I wanted to take all the opportunities that were available. So luckily, I was at a lecture one day in St. Catharines, and who would present but Greg Curnew. And after the lecture, I went up to Greg and I told him about my situation, and he said, "You come to my office tomorrow morning." And I did, and he looked at our blood work. I remember pointing to I told him about my atrial fib attack, and I remember pointing to his non-alcohol drinks there, and he said, "You know what, if you don't want to go back to Emerge or die from your atrial fib, don't drink anymore." And he scared the living bejeebies out of me. And I said, "No." And one good thing, my wife was there, and we went on his program, and I really think I've done well. I exercise, and I truly think my angina's improved. I can't say I'm angina free, but I can do almost anything I want to. And so that's where I stand with my atherosclerosis and my hardening of the arteries. And I think it's been an inspiration. I wanted to be an inspiration to my children too, because they probably inherited my gene. I think it's more than one gene. It's probably, Dr. Kerner could tell us, but it's probably more than one gene. And you give your children a set of these genes, it's probably just not one thing. And I think that we can manage this through lifestyle changes. And I had the motivation that I love my family dearly, and I want to stay and see them flourish.
So we'll come back to that when we look at your blood results. We'll talk a little bit about your genetic factors, how we can understand this better. So one of the things is that it's really important to know your risk factors for heart disease, and we'll come back to that just in a sec over here. And let's have the next slide. So this is actually Framingham scoring system, and this is actually how physicians predict risk of heart disease. So Framingham, Massachusetts, many decades ago, in the 1940s, it was decided we had to find out what caused heart disease. So the first while was just collecting data on a couple thousand people, then getting their spouses and getting the rest of the family afterwards. And we found out that don't get older. As you get older, risk of heart disease goes up. And cholesterol, blood pressure, cigarettes, diabetes, these were what we learned to be the major risk factors for heart disease. And of course, family history. So cholesterol, an average cholesterol was 5 back then. It still is. An average cholesterol leads to heart disease in about 50% of us. Ideal blood pressure is 120/80. Every time you smoke, 5 to 10 minutes of life is lost. You mentioned family history. So what we learned is that there's certain diseases, and if you go back to some of our videos on genetics, familial hypercholesterolemia is a disease present in 1 in 100 to 1 in 200 people in Ontario, where your cholesterol is 8 and your LDL is above 5 in adulthood. And it leads to heart disease by the age of 50 in half the people. Phil's cholesterol is better than most, and so he doesn't have this genetic abnormality. What he has, if you see, is that he has multiple family members with heart disease before the age of 50 to 60. And what you have is what we call a polygenic hypercholesterolemia or polygenic, atherosclerosis. So what's causing your heart disease is not your lifestyle. In a sense, you're not overweight, you don't smoke, your blood pressure is good, you don't have diabetes. But what you do have is a series of probably 500 genes that all contribute to atherosclerosis 1 to 2% of the time. So polygenic scores are not readily available yet. They'll be coming. But you know what? Don't need that. Look at your family history. It's, a cheap man's or cheap woman's genetics is basically your family history. So, and you had one family member increases risk by 30%, two family members 50%. So it just increases your risk. So, we always say, well, my dad smoked, my great-grandmother didn't exercise. In fact, our grandparents and our parents were thinner than we were and exercised more than we did. I was just talking to a farmer today, and the one time a farmer was hard physical work. He says, my farming is sitting in a nice tractor, air-conditioned, heated in the winter time, and I spend most of my time talking on the phone to the world and things of that nature as well. So that's what farming is transformed at this stage. We're not as active as we were before. So Framingham's a way of predicting 10-year risk of vascular disease. Next slide, please.
Yeah, so this is just a quick version to ask yourself, some questions to ask yourself. So if you want to take a moment right now and just think to yourself as I say these questions out loud. So like Dr. Kearney mentioned, does heart disease run in your family? Do you have any other conditions such as diabetes? Does your age put you at risk for heart disease? Are you exercising regularly? And what are you doing to stay healthy? Are you at a healthy weight? Do you have high cholesterol? Do you have high blood pressure? And do you smoke? If yes, have you thought seriously about quitting or at least reducing it? Do you drink? Have you thought seriously about reducing it or quitting altogether? And so if you would like to find out a little bit more about these risk factors that we talked about, so these are known as traditional risk factors, you can go to our atherosclerosis webinar, and the timestamp is between the 38-minute and the 48-minute mark. And again, just to drive it home, it's that you are still in control of your health. You may have these risk factors, but there are things you can do to improve them and to improve your health. So speaking to genetics, it's also very important that you get a full understanding of your family history. So as you can see right here, this is an example taken from the atherosclerosis webinar. It's kind of a general understanding of your grandparents and your parents' medical history. Instead, we would like you to put on your investigative goggles and your investigative lenses and to look a little bit deeper into it. So as you can see over here, it's a lot more detailed. And it's important that you reach out to your family members to really understand the conditions that are part of your family. And so if you would like to learn more about this, there's a great webinar on it that Dr. Kearney mentioned, the Heart Disease and Genetics webinar. So going back to Dr. McGarry's risk factors, as you can see over here, like he mentioned, he does have the family history as well as his age that puts him at risk. However, the lifestyle stuff, he's fairly good with that, and on top of it, being on top of his health. As you can see over here, Dr. McGarry, feel free to jump in. You guys are at a healthy weight, and you exercise frequently.
Yeah, we cycle, we golf, we do a lot of walking. I always said we don't let the weather stop us. I always had patients say, well, I don't exercise in the winter because of the weather. I said, well, don't you have a coat? Come on, you're Canadian. Don't you have snow boots? Don't you have a scarf and mitts? We're Canadian. You got to get out there. I don't accept our climate as an excuse for not exercising. And we more or less raised our children that way, didn't we, Joanna? We always, I love the winter. And we do winter sports and that. So
now, I would just like to say something because Philip and I were married, while we were in medical school. But I was well aware of the fact that there was coronary artery disease in his family. So even back then, in the 1970s at medical school, we knew of risk factors. And as Dr. Kernu alluded to the Framingham study, we were well versed and taught about Framingham study, so I was well aware of family history. But I think maybe now we know that family history may become more important as perhaps we get people's blood pressure more under control and as we get cholesterol more under control. But anyway, from very early on, we always lived a healthy lifestyle. I was one that always enjoyed exercise, and so we always had a lot of exercise. We rarely drank. I mean, rarely. We did a lot of work being on call and whatnot, so you couldn't drink while you were on call and all this kind of stuff. But anyway, drinking wasn't a part of our lifestyle particularly. Still, even with that, even with those precautions that I thought would help protect both of us, especially Philip, he did get coronary artery disease by age 65. So
I probably had it before that.
I worry what would have happened if we hadn't taken those precautions. Maybe he would have got it, 10 years earlier.
I'm sure I would have.
I don't know. And also I was doing that because as family doctors, there's certain expectations that the community has on you, and we always wanted to talk the talk and walk the walk. So we always tried to be healthy so the community could see it. I remember shopping. People would be looking in my grocery basket to see what I was eating. And that's good because we have to model what we teach. And Philip and I believed what we taught, so we modeled it. I think that's important, and I think, we all have to remember that we have to model what we believe in. So that's my perspective on some of this risk factor business.
Well, I think you're right, Johnny. I had a first cousin die of a heart attack in his 50s. My uncle's son. So it runs in my family, and I'm sure I wouldn't be in health now. So if I hadn't been married to Joanna, I probably wouldn't be here. Joanna is my rock, and my.
I was just wondering, is Emma going to bring up a slide on denial, Emma, or not?
Yeah, it's going to be a little bit later down.
Great. Okay. Great.
Well,
Carry on.
So the next slide, I just pulled up a Statistics Canada document from the most recent values I could find, which were from 2012 to 2013. So this is just a chart about some of the average LDL and total cholesterol and healthy DL cholesterol values. So, and then let's take a look at Dr. McGarry's values pre-diagnosis.
Just back one track over here. So a healthy cholesterol or an average cholesterol 2.93 or 2.66 if you're male or female doesn't sound bad, but it's bad. Being average kills 50% of males and 80% of males and 50% of women will get heart disease with some of these values here. So you don't want to be average. You want to be well below average. There's nothing good about LDL cholesterol.
So Dr. Kearney, if you could also speak to Dr. McGarry's lab values.
So remind me, Philip, when did we first meet? When was your first cholesterol values that we saw together? Do you remember when that was again?
I'd say about 4 years ago, 5 years ago.
Okay.
I was only diagnosed maybe a year or less when I met you. And I wasn't, and it was my son that actually told, my son's a family doctor too, and he was the one that told me that you're not on a high enough dose of statin. And it was just before that he told me that, and then when I met you, so I think when you see the numbers of even, I think it was around like November of 2014 or so.
Okay. So, we had this magic number, aim for an LDL cholesterol less than 2. And people say, LDL cholesterol at 2, I'm done. I'm not done. Basically, what we learned right now, you mentioned these injectable medications called PCSK9 drugs, which we have 2 of them currently in Canada, is that what we learned is that of all the different preventive strategies that work really well, you mentioned you had 2 problems. One is atrial fibrillation, and blood thinners lower the risk of atrial fibrillation, causing stroke by about 70%. And we also know for every 1 millimole reduction of LDL cholesterol, you decrease cardiovascular events by 20%. And you can see that, many people say, I'm done with an LDL cholesterol of 2. I'm done when your LDL cholesterol is as close to 0 as I possibly can. And for people who are serious about their heart, and especially if people have heart disease, I would aim for an LDL cholesterol less than 1.0. And in 2007, this year or the year before, the European guidelines suggest an LDL cholesterol less than 1.0 in patients who had more than one cardiovascular event, especially in the first year or 2. And so when you say you want to be proactive, is that you're absolutely right. The data has been the data for many years. That lower the LDL cholesterol, the better off you are. So my current way of looking at it is, yes, diet and lifestyle change, and you're doing all that. Your LDL cholesterol was in the mid-2 range, so we'll maximize to the highest dose of Lipitor, which would be 80 milligrams a day, or the highest dose of Luvastatin or Crestor, 40 milligrams a day. Then we'll add in ezetimibe, 10 milligrams a day, then we'll say hello. And if your LDL cholesterol is still well above 1, you can decide if you want to add something called the PCSK9 drug to your regimen and aim for an LDL cholesterol less than 1, because there's actually data that if you get the LDL cholesterol to 1 or less, there's potential for some degree or mild regression of coronary angiograms. There are many other risk factors too as well. It's not just a disease of cholesterol, but this is something that it really irks me when I see so many people, I got that LDL cholesterol of 2. Well, getting LDL cholesterol down from 2 to 1, you lower your risk of heart disease by additional 20%. And I don't know about you, is that I want to be around for as long as I can, as healthy as I can, and not having a heart attack or a stroke is kind of important. And you can do that quite easily. So thanks for sharing that. And you can look at his hemoglobin A1C, the blood sugars, is that the definition of diabetes, the hemoglobin A1C of 6.5% or less. You've done extremely well. So lower the hemoglobin A1C, the better off you are. But getting in the low 5 range is ideal, and the mid 5 range is fine. And you've done a great job. And I remember going bike riding with you and your lovely wife, and how active. And I also appreciate the conversations that we had, the friendship, and you mentioned mentorship. And one of the things that's important to us older physicians is that we want to make the world a better place. And people like Emma and Stuart and others are making the world a better place. And it pleases me immensely to watch you young people develop and do such a wonderful job. And we are better because of you, and I hope we can make you a little bit better. But really think about who you get your information from, and really how to make this happen. I'll let you take it away there, Emily. Emma, sorry.
No worries. All right, so once again, these are Dr. McGarry's risk factors. I just want you to all keep this in mind as we move on through his diagnosis. So he was diagnosed with angina, and I don't know if Dr. Kern, you want to explain this graph a little bit more?
Sure. This is actually called a coronary angiogram. And one of the things is that, so first of all, to make a diagnosis of coronary artery disease, the best definition is this tightness in your chest that comes on exertion. So when you went skiing, you got this burning or this indigestion, you thought, going down the ski hill. Anything that's exertional related, lasting from about 30 seconds to about 5 minutes, makes me think of angina first. And we need to look at that. And now, you don't always need an angiogram to make the diagnosis, because unfortunately the risk of dying from an angiogram is reported at 1 in 1,000. The risk of dying from a stress test is in the order of 1 in 10,000. So it's really important to know where we stand, and so you have to decide what's your physician's the optimal strategy. So we do have a webinar on cardiac testing, and basically the stress test is our workhorse for looking for coronary artery disease and severe blocked arteries. And sometimes we need an angiogram, sometimes we don't. The mistake I see too many times is that if my vessels look okay, they're not severely blocked, I'm okay. You're not okay. And what determines your outcome is how much you change, and the risk factor control is more important. So we have to turn off the tap and the risk factor. So a coronary angiogram certainly plays a pivotal role for many people. It's only one part of that repertoire of tools that one has available to make the diagnosis and to follow the progression over time.
So angina is basically the physical symptoms of coronary artery disease, and it happens, like Dr. Fernie mentioned, when your heart arteries are too narrow or getting blocked. And what happens is that the heart muscle is not getting as much blood as it needs. So now we're just going to watch a quick video.
I love this video. Great video.
Emma, do you mind turning up the volume on the video? Is there a volume?
Yeah.
Perfect, thank you. Not sure if it's just me, but I don't hear the sound in it.
Oh, are you not hearing the sound?
Oh,
No.
Oh, sorry about that. I can hear it, so that's bizarre. So if I play it now, can you still hear it? Can you hear it now or no?
Maybe press play? No, not hearing it.
Okay, sorry about that.
So this actually so why don't you just play the video and I'll describe what's happening here. So this is actually what's happening inside the vessel. You can get narrowing of the vessel because of blocked arteries. You can see here the nice magnifying glass. That's the vessels of the heart. These are major highways that we look at over time. And when those arteries become blocked, usually greater than 70% or so, you can develop chest pains called angina. You can see that blockage. It's not a linear progression. So the description is you get this, it's not a pain doctor, it's a heaviness, it's a fullness in my chest. It comes on with activity. To make the diagnosis, we can do different testing. We can do things like a coronary angiogram to figure that out if we want to. And there also can be actually spasms of the vessels too as well that can superimpose. And the newest and the latest right now is problems with the microcirculation. So we're learning a lot. So we can actually picture the main highways called the vessels, the angiogram. Then there's a smaller vessels and spasm. So Emily, why don't you explain this slide here?
Yeah.
Emma, sorry.
So some symptoms include chest pain or pressure, a sensation of fullness, squeezing in the center of the chest, and all of these sensations may spread to other areas as well, like they mentioned in the video, such as your arms, your back, your neck. And I think a great takeaway from angina is that it is a warning sign that worse things are up ahead. So you could have a risk for heart attack, cardiac arrest, sudden cardiac death. However, there is still time for change, because again, this is just a warning sign to get your stuff together and make healthier life decisions. Yeah. And so for Dr. McGarry and for everyone else, I just want you all to take a moment just to think about which of these risk factors are actually within your control. And the ones that are within your control, what will you do about them? And so for Dr. McGarry, and for other people, the genetics and the age, those are mostly out of his control, right? He can't grow younger as much as he tries. And other things are within his control, such as his exercise levels, his weight, his cholesterol levels, his blood pressure, if he smokes or not, if he drinks or not. And because these things are within control, the only way to fight them is lifestyle changes, along with medications. And so the next slide, Dr. McGarry, if you would like to explain a little bit about your lab values over time. I just exported them into this chart.
Yeah, so in 2016, that's when I was diagnosed, and that's roughly when I saw Dr. Kernu. Maybe 6 months after that, I got onto his program for aggressive treatment of cholesterol. And I also had gone to cardiac classes at Niagara Health. And knowing what I had to do, I remember even telling Joanna, leaving the hospital that day, I said, well, we've got to change, or maybe Joanna told me, we've got to change what we're doing. Obviously, we're not doing enough. So that's when we decided to stop eating meat and to change our diets, which was, that was a hard thing to do, to get off the typical Western diet, even though we weren't big meat eaters. We did research, and we started by watching Fork Over Knife, and as a gradual process, we eventually became vegan, and through a referral with Dr. Kernu sent us to Dr. Ganguly, has a great knowledge in lifestyle medicine and how to be a safe vegan. We went that course, and we've my weight's dropped even more. I think we became more diligent in our exercises program, and my lipids greatly improved. And I've had a few readings where the LDL, they said not reportable. And I think the highest my LDL has been in the last few years has been 0.7, so I'm below 1. And I always get a good smile out of Dr. Kernu when he sees my blood work when I come in for appointments now, that he thinks he's impressed with how my lab work has been. So that's always encouraging, and yeah, I'm happy with my blood work. I'm going to get it done again in mid-November, and we'll see where we are. It's and I think my family members have been eat much less meat now, and they've been helped through this.
So it's kind of, if you go back to one slide, if you were to look, a cholesterol of 4, LDL cholesterol hovering around 2, most people would have said, that's really, really good. You're really not overweight. You don't smoke. You're exercising, but your disease is still progressing. It's still getting worse. And we can't stop aging indefinitely, but we can make the arteries healthier. And you can see in yellow that curve where that LDL cholesterol is less than 1 at this point in time. That's an important consideration. Now, to achieve that, you need to use combinations of lifestyle changes and pharmacological agents to do both. Now, some people can do one or the other. To me, you've done it together. Now, one of the things is you can say is that if you go back in history, I think one of the reasons why Philip lived so long, he took care of himself, and he has a lovely supportive environment and wife and supports and things of that nature. He's just a nice guy, and he's a wonderful wife, and they work so well together. That adds years of life. But I will say this, is that you can have the most supportive environment, the best plant eater in the world, but atherosclerosis can still progress. Or you can also have an LDL cholesterol of 0 and still have progression of atherosclerosis as well, because you also know by getting LDL cholesterol to very low values, there's other risk factors. One is triglycerides, one is remnant particles, one is high blood pressure, one is stress, one is being overweight, lack of exercise, hypertension, Lp(a). I can go on and on from different markers of inflammation. So it's really, this war on atherosclerosis is fought on many fronts. And it's been a real pleasure to work with him and his lovely wife to see how he's made great impact on himself and others as well. Wonderful. So, Emma, have you found out what is the projected longevity of a human being if all things go well? Did you find that out?
So what I've read is that a lot of scientists think that it's too early to say Some numbers have been floated, such as 115, but what I will say is that the oldest person recorded to be alive is a woman from France who lived to be 122 years old.
Oh.
Yeah.
So I'm thinking if you go to places like the Blue Zone, or is that, again, we don't know for sure, but it looks like if everything is sets out perfectly, humans can live to 120 years of age. I'll repeat that. It looks like if you do all the right things, you can live to 120 years of age. What we're also going to talk about is the last little while, last few months or few years of your life is when things start to fall apart. And, you know, so can we expect to live forever? No. But I want to make sure is that what I want to do, everyone, is that I want to retire at 100 years of age. And I hope I can make it. Will I make it? I don't know. But as long as I feel I can contribute to make a difference, and I really want to make a difference, I'll move forward about this. And the way to do that is just what Philip and Joanne are doing. They're together. They're working. They're applying the lifestyle changes. You know, about 30 minutes of activity most days will lower your risk of heart disease by 25%. Lowers the risk of Alzheimer's disease, of many cancers. It makes it easier to keep the weight down, improves your quality of life, less chance to fall, less chance of fragility, less chance of being in a nursing home. We can go on and on. So activity is a vital component to this. The sad part is that less than 20 to 30% of Canadians are active enough to protect themselves. So that should be the norm. Again, as you point out, we live in Canada. We have great distances. I have a coat too as well. And I'll tell you what I'm going to do this winter for activity in a little while. But we have great science as well. And it's wonderful you can see that progressing. Next slide, please.
So in my conversation with Dr. McGarry, he told me that he focused on two things really post his diagnosis. Was that he took a look at his risk factors and focused on the ones that he could change. So you can't change your genes, but you can definitely modify your activities and your environment. As well, like he mentioned previously, he wanted to find a physician that would treat this disease as aggressively as he wanted to. Dr. McGarry, would you like to talk a little bit more on that?
Well, as I already mentioned, having the knowledge that being a physician, I think, has been an advantage. A lot of physicians don't take good care of themselves because they don't have time. It is a caring profession. Unfortunately, they don't make time for themselves. But I had motivation, a wife that was very supportive, and I wanted to find someone that would help me meet my goals. And I knew I could do more than what has been done, because what I was doing, I still was getting atherosclerosis. So what I was doing up to then had helped. I had cousins that died in their 50s, a brother that died in his 50s. So I knew I could do more. So, and because I knew the local physicians in the Niagara Hamilton area, I knew Dr. Curnew, and then it takes a while to get enough nerve to make that change. But I was fortunate enough; he came down to Niagara to give a talk on I think that talk was on diabetes and the new medications they're using for that treatment and how it reduces heart disease as well. And that's when I met him and went up to him and said, "Help me."
I remember that day. You're absolutely right. This is when the newest data was coming out that, first of all, diabetes in my mind has been totally a bust up until the last 5 years or so. Not a total bust, but we weren't making as good headroads. We were concentrating on lowering the blood sugar. But we found out that there's different things about diabetes, that there's remnant particles, there's inflammation, and there's these category of medications called SGLT2 receptor antagonists and glucagon agonists. There's so much we've learned along the way, and it's been a great explanation. I remember giving the talk and you coming up afterwards, and and it's been a real pleasure to work with you and your wife. One of the things, like, I can't thank you enough for taking the time to be healthy and help other people as well. And same thing with your lovely wife.
I just wanted to add something, if I may. I think that you're bringing up a couple of very important factors, and that is we have to have faith in our physicians. So obviously, Philip had known Dr. Kernu and his work for probably 25 years because they would be at conferences or they chair patients. So I think that having faith in your physician or your healthcare provider is very important. And Philip did have faith. And another thing I think that is important is there's a move afoot where people want to try to do things in the natural way. And I remember in my family practice, a lot of the patients were hesitant to go on medications that would drop their cholesterol because they wanted to try the diet first and they wanted to try doing it on their own, which is fine. I mean, if you want to try that for 3 months or whatever, depending on how severe your disease is, that's fine. But when the numbers don't start to fall, then you need some pharmaceutical medications to help bring those cholesterol numbers down. So yes, Philip's cholesterol numbers, say in 2014 or 15, showed that he had a LDL, so that's the bad cholesterol, of say about 2 or 2.2. I know that without the medication, he could not get his LDL down to less than 1. So I think that that's important, that we have to work on this in a holistic approach. But remember, when a method fails, you have to move to the next method. And if we have to take the pharmaceuticals, that's fine. And I'm sure that Dr. Kernu can tell you how good these class of cholesterol-lowering drugs called statins work. But there is very good evidence that they work. And so my plea is for people to use the holistic approach, watch their diet, control the risk factors they can. But when it's time to go on medication, you need to take your medication.
Well said.
And so the next point is about the wheel of change. I'm fairly certain you've seen this at some point in time, but it usually just starts with an idea that you want to change. So your pre-contemplation stage, where you're just kind of ruminating and thinking of that idea. And then you move on to the second stage, where you actually start to get a little bit more serious about it and start to have a plan. And then you go through the plan, so that's determination and action, and you make sure that you maintain it constantly. And then, of course, sometimes you will exit that completely, and other times you will relapse and then go through it over and over again. And in an email that I exchanged with Dr. McGarry, he brought up the idea that it's kind of like buying a car, such as a Tesla, where it's like a big change, right? So you have to make sure that you think through it and you are determined to get that Tesla. You save up the money, and so the cycle continues.
So you mentioned Tesla. It's Elon Musk is, an amazing inventor, amazing person. All his patents for Tesla electric cars are open. He's just made the car better, and it's the only car that gets better. So I remember when it was first coming out, it failed its braking test from a Consumer Report. He said, "Give me the weekend." They reprogrammed the braking speed, and it actually surpassed expectation. How many cars can get better or can learn? An amazing car, and and I never thought I would really liked a car. I love this car, and I wish everybody to get themselves a good electric car at this point in time. It's a better way of getting around. It's a safer way of getting around too, as well. And so I wish we can make Elon Musk a proud Canadian. I would do anything to have him move to Canada. But who knows? You try different things, and don't be afraid to try, because what really is scary to me is how we just stay in that pre-contemplation phase, how we don't evolve, and it's okay. As Elon Musk says, don't be afraid. Failure is part of life and part of learning. It's just a step forward, and don't be afraid to fail big. He blew up 3 rocket ships in a row. He spent $600 million of his money. He was down to his last 20 million, I'm told. And if the next rocket didn't go up, he was bankrupt. But he was determined. So be determined, whatever you do, to get better and to keep trying. And we're going to make mistakes. That's okay. But we get better.
And now he's going to put internet to all us rural people around the world in the next year.
And maybe in our lifetime we'll have an atmosphere on Mars because of him.
Incredible.
Yeah. So speaking to that determination and that contemplation phase, part of that journey is to actually make a plan. And a great way to do that is to just communicate with your physicians and your doctors. Which areas of your life do you want to change? Do you want to work on your diet? Do you want to work on your weight, your cholesterol levels, all of the above? Where do you need help? So where are you kind of unsure about how to approach this challenge? And also to make SMART goals. So SMART goals stand for specific, measurable, attainable, relevant, and time-based goals. So just following that kind of step-by-step process is a great way to get to where you want to go. And part of that is actually how you prepare to go into your doctor's office. And we have like a list of do's and don'ts a little bit later, but in general, just come prepared to your doctor's office, right? So bring your medications list, get your blood work done, prepare all the questions that you need to ask Dr. Kernew. And yeah, just be there with an open mind and listen. So part of that for Drs. Hill and Dr. McGarry is to actually implement the plan in terms of exercise. Dr. Hill and Dr. McGarry, would you like to talk a little bit about your exercise?
You want to do that, Jonah?
Talk about your plan.
Oh, yeah, well, we first went to I went to a cardiac class, and they gave me a prescription. Dr. Kernew did a stress test and told me a prescription of what I should get my heart rate up to, and then you're supervised in the class for 10 weeks, and they review all the risk factors, and our goal right now is to get 10,000 steps a day, and I try to get my heart rate up to the training goal for at least 30 minutes a day. And some days we could do it. Not every day we can. Most days we do. And that's what we're doing right now. And when we get up in the morning, a part of our plan for the day is when do we do our exercise. For me, it's like brushing my teeth or shaving. It's part of a healthy life. It's part of our health hygiene. You have anything to add to that?
Well, I found that the cardiac classes were very good. I didn't go to them, but I've sent patients to them, and they have a very intensive teaching program. So not only do they go over your exercise and your exercise prescription, but they also go through other important values, such as your diet, your cholesterol, the importance of being happy and having relationships. And so I think it's very good. And if anybody has had cardiac events or a new diagnosis of cardiac disease, I would strongly recommend a prescription for a cardiac class. In Niagara, we do them at the YMCA, and we work through Heart Niagara. Probably in different areas it's done differently, but I would certainly recommend the cardiac classes.
And like you mentioned, for your diet, there was quite a big change.
It was a huge change in our diet, but I think that it's healthy for Philip and myself, and I think it's healthier for the planet that we live on. And more people are turning to various forms of, be it a Mediterranean diet or a vegan diet or a whatever type of lacto-old-grow vegetarian diet, but whatever. And I think we should all kind of move in that direction for health reasons and to save the planet. And it's getting easier to do it all the time.
And I think this is.
But I think you have to be educated on how to do this, because from my understanding, it's the fats in your diet that lead to the hardening or the atherosclerosis. So you have to get rid of a lot of the fats. So we know that saturated fats, such as butter and cheese, are bad for you, but other types of fats are not that healthy for you. So that I was fortunate enough to take this 12-week vegan diet course offered by Dr. Ganguly. And he went over some of these important points. So it's not like you can just pick up a vegan cookbook and make this vegan food, because oftentimes vegetarian foods, they do call for a lot of oils, like different olive oils or sunflower seed oils and different things. So you have to figure out how to cut down the amount of fats and oils in the diet. So that's just one thing I wanted to add. And we love our vegan food.
And so
if you go back to that slide again, there's diet is a very controversial area. A couple things. So first step for most people is that 60% of the calories most of us eat come from processed or ultra-processed food. So eat real food that you can actually see and look and grow and touch, number one. Anything that's white, replace with being green. Half your plate should be fruits and vegetables. Eat more beans, and just eat less for most of us. It's kind of interesting about the controversy about different fats. So to me is that liquid fat or liquid calories, you tend to just eat too much of them. So, and one of the bad foods, of course, is now sugar. Sugar used to be, it didn't cause heart disease. It actually does cause heart disease. So to me is that number one priority is eating less calories, and eating non-processed food would be important. Eating less, eating more different colors of the rainbow is important. Now you mentioned is that oils. So to me, what I'm doing is I'm not really adding oil. I can find lots of healthy foods. I mean, a lot more nuts. So there's there are a series of trials that show that eating walnuts, hazelnuts, almonds can cardiovascular protective. But the problem is they're rich in calories. So to me, calories are one of the most important aspects of your diet. I eat too much. I'm a nighttime eater. I've tried different things and I go through cycles. But like these two young people here, is that I became a plant-based eater. But I'm a plant-based eater that eats fish, and the reason I still eat fish because I think there's health benefits to the omega-3s, the pure EPA, and there's a lot of data to support that. But also, the other reason why I became a plant-based eater is because I worry about the animals and the planet. So I'm a hypocrite when it comes to fish. So I'm not always consistent, but I'm hoping at some point in time that we can synthesize EPA and fish rates, so I won't have to actually kill anything. I don't want to kill anything, but I certainly want you to everybody have a garden. I want everybody to be active, and I want you to eat more plants and more beans.
And Dr. McGarry and Dr. Hill previously alluded to the stress levels of their life, and in our conversation that I learned that some stress is, of course, good. It's good to help you push to achieve more, to do more. And part of that, once you reach if you do have cardiac disease and issues, it's to really reflect on your life right now. What do you actually enjoy? What do you not enjoy so much and that you're just kind of putting up with? And what do you think you need to modify about your life and your stress level? And so, Dr. McGarry, would you like to speak a little bit more about the impact of fitness on your stress levels?
Well, I think you feel like you're being ground down. Sometimes maybe some activities you had and said, "Oh, I think I feel my coronary arteries clogging up." But yeah, I think it's good to be happy. If you're happy with what you're doing and you're making a difference, there's a balance in life. So I think you're getting too much of one thing, that balance isn't there, and that causes stress. So I think as you age too, I think you get different needs and different enjoyment. And I think your family means more and more as you age. And it's harder as you age too, it's not that you get stupid, but you think a little differently, and you rely on previous experiences to problem solve. Whereas at your age, Emma, you'll problem solve with knowledge that you've read, and not so you haven't had the experience yet, but you can remember how to solve that problem. I think as you age, you tend to use experiences in your life. But I think, if you're not sleeping well, if you're preoccupied, you're tired all the time, think of what you're doing. Are you enjoying it? And think of change. I made a change when there were several peak things happened in my life. And that, everybody, I think you'll know when you need to change that. Would you, Anna? Yeah.
Well, I think also a good thing for Philip and I is that in medical school, we were trained to deal with stressful situations, which is very good because Philip is going through a stressful situation right now where one of his homes has a COVID outbreak. Now, that could be very devastating for the very frail, fragile people in the nursing home, which it is. But Philip's the medical director there, and he is very concerned about these residents, and he is giving his full-on attention. But the thing is, he's been trained on how to deal with stress and how to react in stressful conditions, and also how to make change. So we all have been making changes in the last 8 or 9 months since COVID's hit us. For some of us, it's hit us more personally. For some of us, it's hit us more in our professional life. It's been documented in the local newspaper in Niagara Falls that his home has been taken over by the hospital. But it's not really that the hospital has taken over this home. What it really is that the hospital is trying to supply some resources. And so this is actually a very good thing for the residents. And Philip can speak to this, but the hospital is supplying more help in the way of their infectious disease physician is helping look into the situation. A lot of the senior nurses at the home have had to go off on sick leave. So that means that they need some more senior staff members, and the hospital is trying to supply that for him. There really isn't a problem with PPE. That was a problem that happened about 7 or 8 months ago, so that's not a problem now. But in the big picture, I think it's wonderful that the hospital is trying to step up to help this home, help Philip, help the residents. And that's the way we have to work in a community. We have to help each other out. But I'll let Philip, who's the medical director at that home, just speak about his stress level.
Well,
But that's my interpretation.
Yeah, I think when you there's different stresses in life, some you're not prepared for, death in the family, or changing careers, or that COVID has taken away many people's income and jobs. But many of us, we have the training and not overreact, and you can't solve all the problems all at once. You have to look at one problem at a time. And I think having the training, let Dr. Turner speak on that, but I think having the training and the knowledge that these problems are solvable, and if they're not solvable, you know where to get help to have them solved. Yeah. Greg, do you have anything to add to that?
That there's also all sorts of obstacles out there, and one of the things that I find, I'm becoming angry at many of my patients for not working hard enough during this COVID situation to be healthier. I got to watch that. I want the best for everybody, and what I'm seeing is that too many people are just saying, I can't go to the gym because I can't exercise. I'm not eating healthy. I'll eat bad food. I'll drink too much. I'm under stress. I got it. We're all under stress. But you know what? This is the time where we need to get some grit, and we're going to actually post a video about grit. And basically, gritty people or people is that the higher the level of stress, the higher you work at it. There's nothing wrong with hard work. There's nothing wrong with trying to be innovative. There's a lot wrong with not trying. And so my frustration when people aren't prepared for their visits, don't show up for their visits, saying, I told you that last time. No, it's time for, we're in a new situation. We're learning a lot. We're getting better. And this drives us closer together. So we need to work together, and we need to work better at this. So I have to just sort of tone it down a little bit. I get it. But people have to tone it up as well. I thank my parents for installing in all us Kernews is that my sister calls it the Kernew curse. When times of stress, we just work harder, and that should be everybody. And I want people to just work harder at their health. I don't expect you to be successful, but I sure like to see people give it their best, and also importantly, make it better for the rest of us, and working together. And if we do this, then we overcome COVID much more quicker and more easily, and we learn. Because this is also a great opportunity for learning about your inner strengths, and how to become stronger and more resilient. So, and there'll be times where I can save the world. Other days I'm just falling apart.
But I have a suggestion, if I could just interject. I totally agree with you. However, if Emma could just put up the slide on the contemplation and pre-contemplation, if she could put that slide change up, and I think that's exactly like what we're talking about is change. Is that we have to help each other get into this change diagram so we can move into action. And I think there may be ways that we can help people in their pre-contemplation, to get them into their contemplation, to get their determination or their grit going. And I can't just think exactly what it is, but I know that there are ways that we can move people from the, superficial way of trying to actually get them to move into contemplation, to determination, to action. And another time they need the same thing is when we relapse. It's kind of like a smoker. They do really well. They get off their cigarettes for 6 months and they have a relapse. Well, all they have to do is move back onto the wheel, get them back into contemplation, determination, action, and then they're going to be non-smokers again. But I think that this is very important for everything, because I know for Phil too, sometimes he would say, oh, I'm going to give up on this diet or whatever. But I said, not really. And you just give him some support, and bingo, within 4 or 5 hours, he's back eating his vegan food again. So I think that, yes, I think you're right. And I think that you need the right person supporting these patients. And I'm sure that there is literature on how we can move people from pre-contemplation to contemplation. And I think that
See where they are on the wheel.
Yeah, where
right?
are they on the wheel?
So rather than get angry, I think you try to question them and see where are they on the chain. And maybe not everybody has the same coping as other people. They don't have a Joanna behind them, or Mrs. Pruno behind them. And a lot of people don't have that. And they don't have the education that we have. I mean, we're in the top 1% of our education, probably. Hey, Joanna, what you say, our university graduates?
Well, I think the thing is we have to know how to use the resources. Like, how do we get people to move from contemplation to determination to action? And there's other factors in your life, like, you lose your job. That's a big problem, and that's going to throw you off. There's been a death in the family. There's all kinds of reasons why people, aren't where we would like them to be. But I just put out a plea for everybody to realize where you are in your change process and move ahead to the next step.
So you mentioned about with the looking on research about contemplation to action is that a contemplator or is saying, I would like to change buts. There's too many buts. And so what you have to do, make it easier to put more positive buts. So one of the things that we're offering people, and we'll show that at the end, is that we'll give you 100 ways of doing it, and we'll give you 100 people to support your change if that's what you want to do. Is that so the initial step has to come from intrinsic motivation, and it's something we have to help you get moving forward, but you have to get yourself moving forwards. If it's always going to be somebody else to move you forwards, we're going to have some trouble, but we'll help you. We'll drag you, we'll support you, we'll love you, but it's important is that you can get better. And one of the things is that I'm working with a lot of project students right now at McMaster, and what I'm pleading for them is fail big, and learn and move forward. It's like, I want to get better, but to get better, you gotta suffer a little bit. You gotta make mistakes. It's not going to be always the first time around. If it was so easy, we could all do it. But you know what? This is a time where we are working together, and you can see such wonderful innovations, such wonderful work in this area. So you're absolutely right. I'm in my action phase most of the time. I get mad at myself for getting mad, but I'm trying, and I will keep trying, and I want you to try and just try to help the person next to you a little bit. That's all I can ask. So you're absolutely right. And sometimes it's very crystal clear, and sometimes I don't see where that person's at right now, and thank you for pointing it out to me. I'll keep trying, and I'll get better at it.
All right, and so for the next few slides, we have Dr. Joanna Hill talking a little bit more about her perspective of things. Dr. Hill?
So, Joanne, what was it like dealing with your husband who had heart disease, and what was your thoughts on that? We might have lost their connection at this point in time, and they'll get back to that. So maybe we'll come back to that in a little bit, because I'd love to see what she has to say about this, because she's one of those individuals that makes people better and does a lot of ways.
Yeah, for sure. So the next few slides we have on are about spotting misinformation. So there is already a webinar on this, but we just wanted to touch on it a little bit because Dr. Hill and I also discussed that a little bit. So information literacy is kind of knowing what's real and what's false. So there's a whole bunch of stuff being thrown at you on the internet especially. such as you might see these essential oils or these easy, fast, one-time fixes, these miracle pills that will help you lose 10 pounds overnight, and you will no longer have any signs of heart disease. And from my opinion, if it sounds too good to be true, it likely is too good to be true. And so one of the best ways to understand what's real and what's a little bit more false is to just go to your physicians and just to ask them, oh, are they back?
Yeah, we're back.
Okay, perfect.
So we're going to back to your slide there. And one of the things that I learned is that technology never works as well as you want to. And I'm blessed. I went to this great lecture once on how do you get old doctors like us to use technology. You find young people. So I have about 100 people that are trying to get me better. I woken people at 2 o'clock in the morning because my computer screen is blank. I thought I lost all the data, etc. And I thank everyone, such as Emma and Stuart's working really hard there, trying to make these things work better despite me. But right now we're going to get Joanne to tell us what's her thoughts on when you found out that your husband has heart disease.
Well, to tell the truth, because we were skiing together and I knew he was having chest pain with his physical activity, I was highly suspicious that it could be coronary artery disease. So obviously I was very worried. And then when he did have the tests, it was very difficult to hear the news that he did have heart disease, but at the same time, I wasn't really surprised. You always want to, deny that this is happening to your loved one, but I was right there skiing with him when he got the problem, and although he didn't look ill or anything from the way he described it, I knew that this could be a serious issue. So I knew that once the diagnosis was made, I knew that because we'd been healthy all along, that it was going to take more than just luck to overcome this. And so I got my grit right inside me, and I said, no, we're going to have to do better. We're going to have to do whatever it takes to help overcome this disease. And whatever it takes, we'll have to do it. And we've got to just start today. So that's the way it was. And Philip didn't show any sign of resistance. He said, yes, if that's what we have to do, we have to do. From time to time, he would say, do you really think that test was right? Do you believe that test? And I would have to say, yes, Philip, I believe the test. You have heart disease, and we have to deal with it. And so while it was worry and a stress, you have to look at what alternatives do you have? I mean, to go backwards, you don't want to start drinking too much, you don't want to start not exercising and doing all the bad things, so you just have to decide to move forward. Philip was enrolled in a cardiac class, and then he didn't want to attend all the classes. He said, I know this. I said, never mind. It's not about knowing it. It's about understanding it and getting it in your brain and your thought waves so that you always think about this and you make the right decisions. Also, when you're there, you meet other people that have your same disease and are going through the same things you are, and I think it's important to develop those relationships and see how other people are coping with it, see what you can do to help somebody else who maybe isn't coping quite so well. So it is a worry, but you just have to move forward. And our children were all worried, so I told them, Dad's making changes. You have 50% of his genes. I think you should start thinking about your lifestyle as well. So that's an important thing because in Philip's situation, I think a lot of this is genetic. So I know that some of my children, some of my grandchildren are going to have the same problem. So you want to model the best behavior you can so that those children realize that it is possible to make changes. And I would like to help my friends. I have friends now that are developing chronic disease, and I want to help them any way I can. And if it means just even as much as seeing that Philip and I have changed for the better, and that they have to change for the better, themselves out, that's wonderful. Whatever we can do to help people. And you can't spend your whole life worrying about what you can't change anyway. You have to do what you can to change things and move ahead.
And so we spoke a little bit about how to communicate with people who may not be 100% supportive or understanding, especially when you gave the example of becoming a vegan, and how other people may not understand why you became a vegan or why you can't eat meat anymore. So could you talk a little bit more about that?
Sure. So I think that sometimes people don't understand exactly what you mean. So rather than soft pedaling it, I would rather tell the people straight up whatever it is, so they get a clear message. So sometimes if we would go to a party, I mean, we would occasionally have a social drink, but now we don't have any alcohol. We haven't had alcohol in like 4 years, I guess. Because if Philip actually takes alcohol, he gets an atrial fibrillation attack, and he ends up in the emergency department. He has terrible chest pain. So I just tell people, they'll say, well, why don't you just take a little drink or whatever. And I say, no, we do not drink. Philip cannot drink, and I do not drink. But I'd rather be right up front and tell people this is the way it is. I think your friends want to do the best for you, but they also think that maybe you don't really mean what you say. But yes, we mean what we say, and that's the way it is. And I think you have to give a very clear message. One thing is that Dr. Kerner has his annual picnic, and I've been attending for the last 3 years or so, and it's really wonderful. Because all these people gather in his backyard, and
Beautiful property.
the beautiful property, and most of the people I don't know. I do know a lot of the young people that turn up that have helped over the year with the patients and one thing and another. But you realize that, all these people are patients of Dr. Kernu's, and they probably have a chronic disease. It might be heart disease or it might be heart failure, but they all have a chronic disease. We're all out there to enjoy a wonderful picnic, wonderful food. People bring all kinds of food. Some people bring meat dishes. Some people bring vegan dishes. Some people bring desserts, whatever. It doesn't matter. And everybody is allowed to pick and choose what they want. So nobody's making you eat something you don't want to eat or denying you something that you do want to eat. And I think it's wonderful. And to know that we're all there to support each other is very wonderful. And Mrs. Kernu is very good about having her gardens and backyards just beautiful, and it's just a wonderful, peaceful, enjoyable evening.
In fact, the only requirement for that day is people bring a lawn chair, because we don't have enough chairs, and we have plenty of food, and people bring everything. And I have to thank my wife for putting up for that for me for I don't know how many years. So this is the first year we never had this in many years. So rain or shine, we can have it. We have a barn, and we had different events at different times, from yoga demonstrations to the environment and we even had a soccer game or two every once in a while, and it's been a lot of fun. And I have to point out is that the house belongs to my wife because she's transformed that property into something very special. She lets me visit it every once in a while, provided I pay the bills and things of that nature. But she's really been a wonderful support, and I thank her for the support. And she knows I will get there. I will be late, like usual. I think I've been on time once or twice in my lifetime. I was on time for our wedding. There has to be a second time. I'm just not sure when that was. But it's really nice to see all the crew out there, from measuring blood pressure to calculating your body fat percentage to it's just a wonderful time, and I look forward to the next event. And I think
and there's a lot of sports and activities. Like, a lot of people will play in the pool. They have the soccer ball out there. They have those long cords between the trees that they can walk on or do exercises on. So it's a real wonderful opportunity.
in fact, over this year, because of COVID, I discovered tennis again. I thank my mom for making me learn how to play tennis when I was 10 years old or 7 years old, and I think, I just actually texted him that, do you want to try to play tennis again tomorrow? And he says it's getting kind of cold and his fingers are frozen. I said, well, wear gloves and we'll play some tennis. So want to be outside, and like yourselves, I think part of our DNA is activity. And I wish that for everybody to see how activity can transform your life and friendship too as well. But as you point out, is that you need to use the right medications, right procedures at the right time. And the things is that you have to rely on people that you trust and on experts. And we'll come back to that just in a sec over here. Thank you for bringing that up.
And so, just as Dr. Kearney said, Dr. Hill, as a physician, you kind of had the background knowledge and understanding about the severity and how to treat the heart diseases. So I guess to other people who may not have this medical training, what would you say to them?
Well, I think that you have to listen to the professionals that you trust. We're very fortunate in Ontario to have wonderful medical schools. We have the College of Physicians and Surgeons that credential every physician in the province. So that is reassuring. You need trust in your professionals. You need to know where you are. Are you as a patient ready to make those changes? Because if not, those are barriers that you have to overcome yourself. Also, there's many places where you can get reputable information, and you have to know the source of your information. But nowadays we have wonderful family physicians. Some of them are incorporated into like group practices where they have specialized healthcare providers such as nurses and nurse practitioners who are specially trained to help you with your disease, but also to help you find information. So I know that being a family physician for many years, the College of Family Physicians provides us with lots of information to give to patients on different diseases or conditions or whatever. So don't forget that your family physician can offer you a lot of information. Also, the public health. Right now, the public health is tied up with COVID, but they have a lot of information on chronic disease and prevention of disease, particularly cardiovascular disease. They help you with smoking cessation. They have special dietitians that can speak to you about your diet. They have blood pressure clinics. So public health is a great resource, and often it's untapped. Also, we have the Canadian Cardiovascular Society, and they have a lot of information on their website that is evidence-based. So I think that there's a lot of areas you can get your information from. You don't want to be getting information just off the internet or by listening to some of these talk shows, because often that information is false.
But the CBC we heard the other day.
And I heard an article on the CBC. I listen to a lot of CBC programming, and the point of the discussion was that we have to have a integrated system and approach to medicine. But unfortunately, the speaker spoke against statins, saying that statins possibly give you diabetes, so don't take your statins because you might get diabetes. But that's not true. You need your statins to bring your cholesterol down. And yes, there is a small percentage of people that may have some diabetes, but also they may be pre-genetically determined to get diabetes. It might not just be the statin that's giving them the diabetes. But I was very upset with that article because I thought that he might turn many people off from taking their statins, which could be devastating, and they could have a heart attack. So I think you really have to know the source of your information. And I sure wouldn't be listening to information on some of the talk shows on TV and whatnot.
So everybody's situation's a little different, and it's hard to generalize too. And they're there to sell advertising and get you to come back and watch or listen. And having knowledge about what they're talking about, you can be quite critical. But if you don't have, you can't be an expert in everything. So that's why you talk to your doctor and to your specialist and follow their advice. I can tell you, it's helped me and my family, and so it's in your health system and in your physicians, and it doesn't hurt to look things up and study them. And as Dr. Kernu said in his last presentation, be prepared for your visits. Right? Why are you going? Are you on the right track? Make sure you know your medications. What are your problems? What are the tests that you had? Do you know all the results? Write down your results. And now the labs let you look at your results ahead of time, so you know what your results are. You can print them off and bring them if you don't understand things. And should you come back again? Here's what I'm doing. Am I doing all the right things? How can I improve things? How's my disease process going? Very important.
There's so many things to think about. So let's go some of the questions. So I've been thinking about cholesterol for 35 years. I spend my life a good part of the time thinking about this. Here's what we know about diabetes. That statin therapy accelerates the development of diabetes by 6 months in those who are predisposed to diabetes. So if you're going to be a diabetic at the age of 65 years of age, if you take a statin, you'll become a diabetic at 64 and a half years of life, 6 months earlier. Statins will bring up blood sugar by 0.1 millimoles, so a very small increase. But statins actually decrease mortality in cardiovascular events by 50% in diabetes. So I don't know about you, is that this is actually a really good trade-off. If you look about soreness and statin therapies, we just did this again, is that you find 3.3 million hits that saying statins are associated with muscle problems. The reality is they probably are not. And before I die, I'm going to show you another webinar. We're going to do actually a definitive trial on people who think they're sore on statin therapy, and then we'll have to prove to you whether or not you have a problem with statins, or unfortunately just life, it's making you sore. That's a topic for another time right now. But you're absolutely right about getting proper information. I think we as physicians are used to getting conflicting data. I think you heard one day that we shouldn't be wearing masks for healthcare providers. Now we're saying masks for all. I think it's truly remarkable since December, when COVID was first identified, how much we do know already and how much we have yet to learn about this. So the medical world is working at this. There has never been a pandemic that hasn't gone through multiple phases and multiple relapses. So this is nothing new about this. And we're going to learn about who you're going to get your information from. You can get it from the medical experts, or you're going to get it from politicians, or you're going to get it from your next door neighbor, or from the internet. What I've learned recently, Netflix did a very nice review on how Google and other internet providers are influencing behavior. I didn't know how much I've been influenced by this. We're really proud of these series of webinars, and I have to thank all these young people who was able to put this together. These are well-researched topics. They're reviewed, and people's heart and soul are put into this. There is no financial gain whatsoever. It's just something that's important, and I wish you take the opportunity to learn and to share and to work together about this. So this is one of my favorite times when we get to actually to talk and share, and it's really nice to get people's perspective about this and how to find good information for bad information. It's a tough one. We were just talking about this morning, is at one time myself as a healthcare provider and both of these young doctors here, we prescribed hormone replacement therapy, and we thought it prevented heart attacks and strokes. We got that wrong. The science back then said they were protective against heart attacks and strokes. They actually cause more heart attacks and strokes. We evolved about this. When my mother was pregnant with my older brother, she was told by a caring family doctor, have a cigarette, will calm your nerves. We've learned that, unfortunately, that was the wrong thing, but that was the wisdom back time. Science advances at a certain pace, and science is science. So, and I keep saying this, there's two parts of the brain. There's the science and the emotion, and we're a blend of everything. But there's certain laws of science and physics that we have to apply to everyday life. And there's a lot of things we don't understand, but we have that we learn about. You're seeing about spotting misinformation. Paul's one of these young, bright superstars who's worked with me for some time, and keep your eye on this guy. He's going to be like one of the people of the future. Keep your eye on Emma and Stuart. They're gonna transform the world, and it's going to be a pleasure to watch them and to hopefully point in the right direction. And I want you guys to take care of me when I get older. So I'll be glad to be patients of yours. Hope you can put up with me.
Yep. So yeah, speaking to information literacy and just spotting what is false and versus what's real, my general rule of thumb is if it sounds too good to be true, it probably is. So check with someone that you trust, such as your physician, such as your another scientist, just to verify that these miracle pills or these one-time fixes are supposed to be doing what they're saying they're doing. And speaking to Dr. Kearney's emotion versus science, we thought that this was a very relevant topic, especially politically and right now. And I think a lot of the times when at least I look at the news, CBC, CTV, stuff like that, it's often these little flashy phrases that catch my attention. It's like, wow, COVID, it's over now. It's going to go away in like 2 weeks. It's fine. But then the scientist in me really thinks about it. Who's saying this information? Where is it coming from? What are their credentials? And then you kind of have to balance that. So then I did a little bit of research on Donald Trump's credentials, specifically in relation to medicine and science. So we found that he attended Fordham University for 2 years and received a bachelor's degree in economics. So not directly applicable to medicine or the field of science. And he was elected a president in 2016. Versus Dr. Fauci. So he graduated from Cornell, the medical school, in 1966. He then did an internship and residency at the New York Hospital and Cornell Medical Center. And so for 36 years now, almost 4 decades, longer than I've been alive, he's been the appointed director of the National Institute of Allergy and Infectious Diseases. So he's advised through 6 presidents on the HIV and AIDS. So he knows his stuff. And basically the question is, who are you going to trust? Really think critically about where the source of information is coming from, like Dr. Hill, like Dr. Kearney mentioned. It's really important to kind of think scientifically in these cases where the impact is going to be huge, right? So if you had listened to someone like a president who mentioned something about certain medications that where the evidence is still not clear yet, that could have a detrimental effect on your health or the health of the people you love. So it's really important to keep these things in mind. Dr. Kearney, would you like to add on?
I think you nailed it. I had nothing to add.
All right. And so I'm going to turn it back to Dr. Hill and Dr. McGarry about some motivational strategies on how you stayed motivated to stay on track with your health. How did you keep going through that determination and action phase over and over again?
Well, I think you have to have the motivation, and when you contemplate, I think when you get some changes you make to get your goals, you have to have, I think, a goal. My goal, as far as my cardiac disease was, is to minimize, to stop it in its tracks, because I want to, as I mentioned earlier, live to see my family mature and grow up. And so that was all I needed. I had determination. Being a physician, it was difficult to get into medical school. You had to be determined. I had the support of family, especially my spouse. And the determination came with my personality. And then I had the knowledge of being a physician, and I had colleagues help, particularly Dr. Kerner, and help guide me through this journey. And I think to be motivated, you have to have your goals. When people maybe not motivated, you have to go to that change and say, well, maybe they don't understand about their disease. Joanna, like smokers, I think you try to say, well, you're going to have to shorten your life or cancer. I don't think they hear you. And so but I was surprised, Greg, is that I had patients maybe a year or two or a few years later. I asked them about their smoking. They used to stop and say, I thought about what you said over and over again, and I finally got motivated to stop smoking. And I thought I was wasting my time. I would tell people to stop smoking, and that really impressed me, that we do have an influence. May not help right away, and it depends where they are on that motivation change. So that's my personality and my story. And do you have anything to add, Joanna?
No, I think that's our story.
That's our story. And I hope, I think it's working. I can feel my exercise tolerance is improved. My angina is better. And I think I'm on the right track. And I wish everybody the success that I've had, and keep the faith.
And so the next slide I have is just a quick summary for all 3 doctors. So how does being a physician change your approach to health? And so from what I gathered, it's that the background knowledge is for sure useful. However, there are still many different resources out there. And for Dr. McGarry and Dr. Hill, you personally witnessed, especially in your long-term care homes, what happens to people when they don't take their health into their hands and be proactive about it. As well, you understand the limits to your personal knowledge, right? So like as Dr. Hill pushed Dr. McGarry to continue to go to those cardiac classes, it's, even though you feel as though you know everything, there's still more to be learned out there. And Dr. Hill alluded to this as well in differentiating between real and some false and misleading information and how to navigate those waters too.
Very well said.
And so for Dr. Hill and Dr. McGarry, we were hoping if you could talk a little bit about preparing for the future, as you are both long-term care home physicians, and just kind of how do you prepare for your life when perhaps you won't be able to take care of yourself as much as you do right now. You've lost a little bit of autonomy. So how would you prepare for that?
Well, I think that would be good. Another topic that I think we should, spend some time on. But I think I can tell you what we have done, and I think being a nursing home physicians and knowing that we can make changes to, as Dr. Kruner said, the last couple of years of your life are going to be maybe not the best health, but you can delay that time by years. But I'd be happy. I think that would be another evening sometime this winter. We should do that. How to prepare for the golden years and how to stay out of nursing homes. And if you have to go in a nursing home, do it when you're 120 or 118, not when you're 60. And so I think we should. I think that's a huge topic, Emma. What do you think?
Yeah, for sure.
Should we meet again and do this later this winter?
Yeah,
Talk
I
about
would love to do
preparing
that.
for the future. What do you think, Greg?
Absolutely.
Yeah.
I think Joanne and I would be happy to tell people what we're doing right now and how we're getting ready for the future.
I will just say this, is that I like your idea, is that the last part of most people's lives are often spent in illness. And we'll show you a couple bits of information about that. But you can actually delay and change that clock. So what you've done today is you changed your clocks, and hopefully we can help other people make those changes. They're hard, but they're well worth it.
So I guess food for thought until we prepare that webinar is to really think, where do you want to spend the last few years of your life? So for me personally, I've had this conversation with my grandparents, my parents, and they've all said the same thing. They want to spend it at home, in their own comfortable home where they're around family, and it's still, in the place where they've lived for quite a few years now. So I think it's definitely another conversation to be had, so stay tuned. And so for the next few slides, we did a little digging into the cost of healthcare, especially as you do age. So there was this really interesting study that I found that was published in 2015. What this study did was collect all the deaths from April 1st, 2010, up until March 31st, 2013, so a 3-year period, and analyze them, and especially the cost of helping these patients. So what they found was that 0.67%, so this is less than 1%, of the population consumed 10% of Ontario's total healthcare budget. So that, to me, is a crazy statement, or crazy thing to have found from the study. And if you take a look at the graph to the left over here, you'll see that what it's done is that this is the days prior to death. And you can see that it's fairly stable for about, pretty much 11 months, up until that very last month where it jumps and it skyrockets, pretty much 5 times the original cost that it would have taken to take care of these patients in the first month of that last year of their life. So on to the next slide. It was calculated that the average person generates $14,000 in healthcare costs during the last 30 days of their life. And so there's been a huge push in Ontario, in the rest of Canada, internationally, for this care to be set outside of the hospital. So it's more comfortable for patients. Many patients prefer this. And a lot of the costs come from that hospitalization, from those inpatient cares. Dr. Green, would you like to add to this?
No, I think that's absolutely right. And I think the important thing is that here's where you don't want to get good value for your health care. I want to cost the health care system next to nothing. People go to a buffet and want to get more for less. I don't want to use healthcare dollars. And I know how to advise you to help you so that can happen. And I think other physicians know that too as well. So my plea is do your part and work hard to be healthier. And, if you do one thing today is give up 1 or 2 meat meals a week, give up this notion that I can't change. Yes, you can. Get a pair of good walking shoes and try some beans.
So that brings us to our first takeaway. Your doctors are here to help. And the best way for them to help you is if you come prepared to the doctor's office with all the questions, with all the medical information that your doctor needs to make the best medical decisions in terms of your health. So don't be afraid to ask for information, resources, and help. So like Dr. Hill mentioned, the physicians have a great and vast amount of resources at their hands. All you need to do is ask for it. And to make goals with your doctor. So remember the SMART goals, and to stay motivated. And so this is just a quick checklist of do's and don'ts to help you navigate how to be best prepared for your physician's visit. So please do come to appointments prepared. Please do be open, and please do listen and ask for clarification when needed, and please work hard. So some don'ts is that don't forget your medication, your blood work, or anything else that you might need at your visit. And please don't forget that we're on your side. So we may challenge you to take new steps in your life, but it's not because we're here to antagonize you. It's here, Dr. Kearney is here to help you, right? So just keep that in mind as you move forward into your visit. So main takeaway number 2 is to not procrastinate your health. So this is a moment, myself personally, is to think about what do you want as your future? Where do you see yourself in 10 or 20 years? And as Dr. Hill and Dr. McGarry mentioned, how do your actions model what's okay and what are its implications on your family? If you're eating fast food, you're eating poorly, you're not exercising, what does that say to your kids, your friends, your grandkids about what's okay for them to do? Another important point is to understand that what are your barriers? What's stopping you from taking that action, from taking that determination step? Who and what can help? So maybe write down a list, just keep thinking and reflecting about that too. And as for main takeaway number 3, this is a conversation that, or this is something that I gathered a lot from Dr. McGarry's conversation, is that a diagnosis does not have to be an entirely negative experience. It's a great way to learn new things, to have new experiences, and like Dr. Kearney mentioned, it's a great way to think of it as a challenge, right? So bring out your competitive side, beat those steps that you set out to do yesterday. And Dr. Kearney sent me this lovely quote, your comfort zone will kill you. Dr. Kearney, would you like to add more to that quote?
People that are successful are people who work hard and overcome obstacles.
And main takeaway number 4 is tips on staying active and healthy. So we do recognize that winter is coming, that COVID has changed many things. However, you can still find a support system. You can still learn from experts. You can still ask for help. Find that winter jacket, find those good walking boots, and just, take a walk outside in the winter. And it's good for your lungs to feel a little bit of fresh air in there. And so these are just some slides, and just as a reminder, what are your actions saying to the people around you? What are you saying is okay? What are you saying is not okay? How do your actions affect the people around you? And to surround yourself with support. So Dr. Hill and Dr. McGarry's story always makes my heart flutter a little bit because of how supportive they are of each other. And she took on this vegan journey with them, took on this lifestyle change with them, and it's really inspiring. And of course, lastly, don't be afraid to always ask for help. So Dr. Kearney, our team, we're always here to help you. And we've created these wonderful webinars on which you can search up pretty much any topic.
Can you just backtrack one slide?
Yeah.
I have to give credit for I have to give credit for all my staff in my office who really have worked hard, and all these young people that have helped. But also on the left-hand corner is my family. I don't see them as much as I do. I love them all and miss them dearly. My wife Carrie is that lovely redhead over there that is the foundation to my abilities to do what I do, because she provides the backbone for this. When I want to be a plant-based eater, she's cooking. She says she hates cooking, but she'll cook sometimes. I love when the kids come home from school and things of that nature, because she'll cook even more. And I've learned from my oldest son, Josh, who is really a guy that's very laid back and goes with the flow so easily. I learned from my middle son Jordan, who's a workaholic like his dad, that he's going to be an engineer, and he says, "Dad, your webinars are too long. No one's going to watch them." When I said we have to design an app, he says, "Don't create it just yet. Just use programming that's currently available." And by the way, I hate exercise, but he lost 50 pounds, and he taught me how to lose 25. A lovely daughter, Jenna, who's going to be going off to BC to work for a year, who's exploring the world and comes from a different perspective, and the grounds my support. And my extended family, the deacons, all these young people here. You see Devanshi up there, who's founded, made great success about a weight loss club, who's preceded by Rachel for 4 years, taught me about being a plant-based eater, how to educate. You can see that Stuart's working hard on designing our videos, going to make transformation. There's Judy in the corner there that is now going to medical school at the University of Toronto, was helpful in developing our book, 30 Days to Healthier You. And it's a combination of all these forces working together. I'm reminded by the Harvard long-term 70-year-plus study, quality relationships is one of the most important things for survival. But also, you gotta use modern science, and you gotta go with the flow and make some changes about that. So I thank everybody for allowing me to serve, and I'll continue to do the best I can. I'll lose my temper from time to time, but I'll try to learn to control that and see it from your perspective. I guess I'm seeing bullets being shot to everybody. I want people to duck and to protect themselves. So I'm sorry if I offend you at times, but when those bullets are coming from the LDL cholesterol, the blood pressure, the lack of activity, the COVID virus, infectious inflammation, CRP, LP little a, I'm going to try to get offensive to try to wipe those risk factors out of your way, so you can live longer and more prosperous, so you can make it to 120 years of age. So that's my goal for everybody, to be as healthy as you can for as long as you can. And Joanne and Philip are more than just patients. They've helped me become a better physician, and I thank you for that, and thank you for sharing these stories. Next slide, please.
Pleasure.
So I'll just say a few words about this, is that the gyms are closed at times, so what? There's different ways to become active. Yes, you can learn and build resilience. High blood pressure, most Canadians will develop hypertension. You got to get a blood pressure machine. You got to learn and measure blood pressure, and we can wipe out cholesterol very easily. We have over 100 webinars, well thought of, long but good, meaningful information. Use them. We have a whole lot more. Next slide, please. This is an encounter today. Lily, she drives me crazy. I love her, but she's been with me forever, and she knows how to read Holter's doing stress tests, and I keep saying just one more, and she yells and screams at me, but she comes out and does it. This young guy here today bought himself a little oximetry for $30, and he wanted to compare it to the $500 one we had over here. His doesn't work as well as ours does, but that's okay. You know what? He also brought me some soup today, and because we're doing our soup phase this month on our weight loss program, and I'm really blessed. And special thanks to Jen, who's been our COVID police, who's been the backbones that keep our clinic going, and we've had multiple discussions with so many people, and I can't do it without everybody in this clinic working hard and everybody working together. So we have, I think, one of the best clinics, and we're getting better, and we're going to learn, and if we can help you in any small way, we'd be honored.
So I'm not sure if the audio is going to work. Can you hear it?
So,
I don't think you hear it.
so basically, we'll put that up as a separate video. But this was just something very spontaneous today. this gentleman was having some chest pain yesterday. He was worried about his saturation at nighttime following. And what happened was the oximetry probe he purchased doesn't work that well. And we put him on the treadmill today. And I said to Lee, we just have to do one more stress test just to make sure he's fine. But you know what? He surprised me with some homemade soup, with some lentils and some tomatoes and things of that nature. I thank everybody for their participation, and Joanne and Philip, you provided tremendous insight. And we're just scratching the surface how to prevent heart disease. What's going to happen is the American Heart Meeting is coming up in the next couple of weeks from now. We're going to know more about the value of fish oils and some more information. We learned that inflammation causes atherosclerosis. There's new therapies for Lp(a). But you know what? The basics are the basics. Good relationships, working together, losing weight, controlling blood pressure, lowering cholesterol, don't smoke, get a pair of walking shoes, avoid processed food. You can make it to 100 just on that itself. I'll give you extra 20 years with the magic of medicine, but what determines how well you do is how well you look after yourself and the people you surround yourself with. So I guess we go with the final slide there next, I guess. I want to thank everybody for this short presentation that was going to only be an hour. What else is new? We'll keep. I'll keep trying, Stuart. But like always, if you have any issues, you can call us, text us. Everybody has my cell phone number. Don't call me. Just text me first because I'm on the phone with somebody else. I'll try to get back to you. If I forgot you, remind me. I'll get there sooner or later. Of course, email us at drkernew@233gmail.com. We're getting better. So, Emma, do you have any final thoughts?
No, I think just thank you to everyone for listening, and a special thanks to Dr. Joanna Hill and Dr. Philip McGarry.
You guys have any final thoughts? What I'll do is, like always, Stuart, you get the last word.
Yeah.
Oh, sorry, hold on. I'm so
sorry. The thing was, you said it very well, Greg. It's been a pleasure to be your patient. Thanks to the whole team at the office for helping us. And it was fun doing this tonight.
You guys are inspirational. You're wonderful. We learned a lot from you. Stuart, how do you want to wrap this
Everybody
up?
stay healthy.
Sorry, Joanne, I'm so sorry.
I was going to say, everybody stay healthy, keep washing your hands, and wear your mask.
Yeah, Doctor, we were at a webinar this afternoon, and Dr. McGarry from Mount Sinai said there'll be a vaccine, she thinks, by August. So we got a few more months to go.
What's very interesting is that the world's going to try to develop a vaccine that's never been created. And you know what? Smart people are working on it. Then we have to vaccinate over 8.7 billion people as well. So lots of things to sort out. So, but the pandemic has taught me to be healthier. So during the pandemic, some people got the COVID-19, gained 19 pounds. I lost the 19 pounds. If I can do it, you can do it. Let's figure a way to work on becoming healthier. What I didn't show you is that my winter activity is that my wife and daughter went to visit my son in Queens yesterday, and I thank Mike for finding this bike on the internet. A Canadian company makes these mountain bikes with big fat tires. I just bought myself a big fat tire bike to go biking in the wintertime. Last Christmas, my wife got me biking for cold weather. I feel like I'll be dressed. I'll be out in those that wintertime biking. Be healthy, and I'll come back for some warm soup afterwards. Stuart, how do you want to wrap this up?
Well, first and foremost, I want to give a huge thank you to Dr. McGarry and Dr. Hill. I think your insights and your perspectives were amazing today, and it was nice to hear from so many perspectives in this week's webinar. So thank you for joining us. We really do appreciate it. If I may have the last word, one thing I wanted to say was I liked those pictures that Dr. Kernew showed of us and the whole team, just because it really emphasizes what we want to make very clear for everyone today, is that You know, we all get stuck. I think that's a part of life. Sometimes you get stuck in good places, but most often it seems you kind of get stuck in the bad places. And it's always hard to get out of those places, and especially starting to try and get out of those places. You know, getting started is the hardest part. I think Dr. Kernu, Emma, myself, the whole team, we get stuck all the time. And how do we get around these things? Well, we have, you know, 99 other perspectives which we can rely on our team. So we don't do it alone. You don't have to do it alone. In fact, you can't do it alone. So having a good support system around you, I think, is one of the most important things that you can kind of take away from this webinar, and what you can take away from, you know, trying to be healthy in life itself. One little piece of interesting information for anyone who's interested. I know Dr. Kernu loves Elon Musk. Elon Musk, for a short period of time in his life, studied at Queen's University, so he's an honorary Canadian. And, you know, he's accomplished some many great things throughout his life, and he's also had to deal with some Canadian weather. So, you know, if the circumstances can change so regularly in Canada with the seasons, and he was still able to set the foundation for reaching those goals, I think you can too. I don't think your goals have to change. Sometimes it's just your mindset and your attitude, and you don't have to do it alone. Again, having a good support system around you is the first step and the most important step.
We all bid you good night, and we're going to stay and discuss things amongst ourselves. So we look forward to our future presentations, and we'll keep trying to make them shorter. But so much to say. Thank you so much, everybody.
Good night, everyone.
And thank you for everybody's hard work.
Awesome.